Well, hello everybody and welcome for joining us today on our Better Health Let's Do This Oxfordshire webinar. My name's Jeanette, I'm Health Improvement Principal in Public Health at Oxfordshire County Council. I'll be chairing this webinar today and introducing all of our presentations and all of our speakers. Just a little bit of housekeeping before we start. This webinar is being recorded so we can share that after the event with everybody, and we will also be sending it around resources. We are operating the chat function, so if you have any questions as you go along, please, we do encourage you to use the chat, and various members of the team today will do their best to answer your questions. And if you have any that we can't answer, then we'll certainly get back to you afterwards because we have people's emails that have joined us. So let's get started on what to expect today. So what we'd like to do is really aim to raise awareness of our latest healthy weight and physical activity offer in Oxfordshire and where you can signpost your patients to. We'll also be looking at the opportunities to have conversations on healthy weight, building confidence, as well as some training opportunities. We will then be hearing from a range of speakers. So public health, so that will be me. I will present our whole systems approach to healthy weight and our local picture, followed by Achieve Oxfordshire, who will provide an overview of their service offer, the referral pathways, and talking about healthy weight with patients. Then we'll hear from Active Oxfordshire, who will highlight the importance of physical activity and the options available within Oxfordshire. And then Hear for Health, who will present their service offer and how you can signpost patients to their service as well. So thinking about the National Obesity Strategy, so this was published in July 2020. It sets out the actions the government plans to take to tackle obesity, and it's very timely really for us because it helped us pick up our whole systems approach work in Oxfordshire following the kind of shutdown for the pandemic. I think COVID-19 has given the government a bit of a wake-up call for obesity, so we're hoping to kind of utilise that and build on that for some of our work in Oxfordshire. So this campaign, the Better Health Campaign, is part of the call for action for the obesity strategy, and the resources are available from Public Health England. In Oxfordshire, our local approach is going to be embedding this campaign into the whole systems approach to healthy weight. And I'd just like to highlight the picture on the right-hand side, which comes from the obesity strategy. Now, this is really showing how there's much greater emphasis on prevention across the whole system, thinking about what we can do to make the healthy choice really the easiest choice, where we work, rest and play. Can I have the next slide, please? So the Better Health Campaign, this aims to reach people who need to lose weight, and it encourages them to make behaviour changes both to eat better and to move more. Public Health England's target audience is predominantly adults over the age of 40 years of age, those who are overweight or obese, so thinking predominantly the BMI range of 25 to 35. The lower socio-economic groups and focusing on our areas of deprivation, Black and ethnic minority groups, and those that are more likely to have at least one long-term health condition. So the local picture for Oxfordshire, where are we now? So this data is presented in Oxfordshire's Joint Strategic Needs Assessment, and we can provide some links to that after the webinar, which shows that adults in Oxfordshire, almost 2/3 of adults in Oxfordshire are classified as overweight or obese. And as you see the graph on the top left-hand side, this differs across different wards in Oxfordshire, and it compares quite similarly to both the England average and the South East average, with some wards being lower and some being higher. From 2015 up to 2018, we can see that obesity and overweight has actually risen in Oxfordshire by approximately 4 to 4.5%, depending on the wards that we're looking at. So the picture for children, this is particularly for obesity in Year 6 following the National Childhood Measurement Programme. The picture on the right-hand side, we see that our children in Year 6 are less obese compared to Oxfordshire, 16.3 compared to 20% nationally, but we'll go on to look that this is not necessarily showing the full picture. So moving on to physical activity levels for the whole population, we're thinking May 18 to 2019 here. For physical activity levels, we do compare quite favourably to the England average, but there's still approximately 30 to 35% of the adult population in Oxfordshire that do not meet the recommended 150 minutes of physical activity a week. So headline facts looks quite good, but then when we start delving into this, it doesn't look quite so favourable. So next slide, please. So we see all of the data is showing us, and I'm sure that we're all aware that some are more equal than others. And again, COVID-19 has put a bit of a spotlight on this. Thinking about our environment, the characteristics of inner cities can very much contribute to the behavioural drivers of childhood obesity and in turn family and adult obesity. On average, there's more fast food outlets in deprived areas compared to those more affluent areas. And children living in deprived areas are 9 times less likely to have access to green spaces. Our Black, Asian and ethnic minority populations are susceptible to obesity-related diseases, particularly type 2 diabetes, at a lower weight status compared to white populations. As we age, we tend to become less active, and it's important for older people to stay healthy, energetic and independent, and we'll hear more from Achieve Oxfordshire on their approach for that group. And then gender, men are much less likely to access our weight loss services, and some of the attitudes that we have both in referral and when people access services can very much deter men. So we'll hear much more from Achieve Oxfordshire on what they're doing to address that soon. So this next slide, it's just showing our 10 most deprived wards in Oxfordshire, and this information is all available in our Public Health Annual Report for 2020, and this highlights the 10 most deprived wards and where we're focusing most of our efforts on. So I would encourage you to have a look at that report for some more information. But if we drill down into this for childhood obesity, the picture on the left-hand side is showing obesity in Year 6, and we looked earlier that we were lower than the national average at 16.3% average across childhood obesity in Year 6. But then we see actually, when we look at the highest rates in different wards, this can be as high as 28.2% in the more deprived wards in Oxfordshire. The circular graph on the right-hand side is just showing the red dotted line is showing the average, the Oxfordshire average, and then we can see the different wards in the different colours, those 10 most deprived wards, and how they all sit outside of that red line. Okay, physical activity. We see a very, very similar picture for physical inactivity in Oxfordshire as well. So this slide is showing November 15 to 16 on the left-hand side and 16 to 17 on the right-hand side. And the areas of Oxfordshire in red are those that are least active and not achieving the guideline amounts. And you can see these little red pockets dotted around our county. So what are we doing so far? There's been lots of work going on, and we've been building on this by pushing forward the whole systems approach to healthy weight. Now, this was endorsed by our Health and Wellbeing Board in April 2019, and we've been working towards developing a framework for the whole systems approach since then. We've divided our work into 3 different areas. The healthy weight environment. Now this includes population approaches to improve the food and physical activity environment. The second theme is support for residents to achieve a healthy weight, and that includes the provision of joined up healthy weight services across the life course. And the third theme is, because it's across the system, is working with partners to promote healthy weight, develop healthy weight systems network and action plans. Today we're particularly concentrating on theme 2, support for residents to achieve a healthy weight. So as part of this work, we've recently delivered a series of whole systems approach workshops that we may have seen some of you at those workshops. We focused on healthy weight for children and families in September, then physical activity in November, and we recently held a workshop on climate and food. We're putting together all of this information and we hope to create a systems map, a causal map for healthy weight in Oxfordshire that we can share with all of our partners. This causal map will then feed into the development of a healthy weight framework, which we aim to have ready by April next year. So, our local response to the National Better Health Campaign is to raise awareness of services, activities and support where you can signpost your children and families to, and just basically make it easier for professionals to help people achieve better health. And that's that target age group of over 40 years of age. We are working with partners to develop clear and simple pathways, and that includes for simple communication resources for adults, children and young people. And we want to deliver a tailored, more personal approach so we can very much target those most at risk in Oxfordshire, and thinking about the kind of the audience for the Better Health campaign, but as well as our 10 most deprived wards in Oxfordshire. And we'd also like to connect professionals with various tools that we have and deliver training to support healthy conversations for better health. Thank you very much. That's the end of my presentation. I'm now going to hand over to Ellie Sullivan, who's the Community Engagement Lead for Achieve Oxfordshire.
Thank you, Jeanette. That was a really great start and a good overview of why we're all here today. So let me just try and get my slides over, and let's just go back to the beginning there. Okay, can you see that? Okay, everyone. I'll take silence as a good answer. Great. Okay, so yeah, as Jeanette said, I'm Ellie. I'm from Achieve Oxfordshire, and I'm just going to talk to you today about the services that we provide and how you can refer into our services. And also just to mention now, we are going to send all of this out to you afterwards, so please don't worry if I'm going through anything a bit quickly today. We'll make sure you've got everything that you need. So who are we? So that goes to great. So yeah, we're Achieve Oxfordshire. We're commissioned by Oxfordshire County Council to deliver free weight loss support to adults. And we do this by offering a range of different courses, which I'm going to speak about today. So just to start off with our client journey. So coming into our service, as you can see on the left here, we have two kind of routes. So you as healthcare professionals can refer your patients to us. We are on EMIS, and we are also currently updating our EMIS form as well. More information will come on that. Or to save you a bit of time, patients can self-refer directly on our website just by clicking the sign up button on the top right of our website. By completing this referral form, whether it's from you guys or themselves, they'll come through to our triage team, who will conduct a motivational interview, make sure that the patients are in the right kind of mindset to take on this change, and to enrol them into the course that's most suitable for them. And I'm going to talk through the different courses available in a moment. On the right, you can see after the course, we like to continue to support our clients. So we have our tier 1 resources, which include blogs and news posts on our website. We have community group on Facebook, and Facebook Lives and all things like that. And we are also starting to roll out follow-ups 6 months and 12 months post completing the course. We also have the ongoing support the whole way through this client journey of the Other Room Gym, which I'm going to go into more detail about. Our Achieve Daily Challenge, which is what takes place on our community Facebook group, and all the tier 1 resources that I just mentioned. So our services. A nice little stat for you there on the left, that last year, 80% of people that completed one of these courses lost at least 3% of their body weight, and I believe that 57% lost at least 5%. So some really good results there. So to start with our in-house service, Lose Weight with Achieve. This course is a 12-week course. It's heavily focused on the education and the behaviour change elements. We do 1-hour nutrition workshops led by our trained health practitioners, and this covers topics such as understanding food labels, looking for hidden sugars, portion sizes, all those sorts of things. When we were delivering face-to-face, we were doing half an hour of exercise there as well. This has changed slightly, which I'll discuss in a second, but we are continuing to deliver this virtually via Zoom, and we've had really good feedback and responses from clients that have been on our virtual courses. But yeah, the education and the behaviour change is really big in our course. Next, Man v Fat. So Jeanette really nicely covered the fact that, yeah, a lot of men don't feel comfortable joining the kind of conventional slimming groups we're aware of. And so Man v Fat came from exactly that. It's for men only. And the first kind of element of what they do is the Man v Fat football. So men go along, they're fit into teams, they play football, and they can score goals on the pitch, but they also score points for their team off of the pitch by hitting their weight loss target. Currently, we're running a Man v Fat football in Oxford Barton Park Pavilion, due to, subject to guidelines at the moment, of course, and hopefully we're looking to get Vista up and running in January, and that's going to be at Whitelands Farm. So that's that one. Man v Fat Challenge. So this is our virtual men-only offering. So this is a bit more accessible, as you don't need to be living in Barton or in Bicester. And this, again, puts men into teams. That still has that competitive element. You score points, goals by completing nutrition, exercise challenges, and also by hitting weight goals. Then we have our voucher offering, so 12 weeks, and we can offer for either Slimming World or WW. I won't go into any detail because I think these are fairly well known, but our Slimming World in particular is a really popular route. So the Other Room Gym, this is what I kind of touched on a moment ago, but this is our new exercise offering since we've gone into this virtual crazy world. And we wanted to make sure we were still giving exercise support to our clients. So this is available to anybody on any of our Achieve courses. So whether that's the Slimming World, Man v Fat, whether it's the Lose Weight with Achieve, they can access this. It's a website online where they can log in, and our physical activity instructors upload exercise classes. We have the mobility room, the progression rooms, they're different levels, right from that real entry level chair-based, people that have never exercised before, quite scared about exercising, all the way up to really high intensity. So something for everybody there. And that was also highlighted in a Public Health England emerging best practice. So that was really great to see. Then our new pilots. So these are stuff to look out for next year. They're not up and running yet. We're still in the process of getting them going, but some exciting opportunities to come. So first of all, our Swim to Slim. Not only is it a mouthful to say, but it is what it says on the tin. It's combining the nutrition aspect of our Lose Weight with Achieve courses with swimming for exercise, but also to help people improve their swimming ability. Next, we have our tailored courses. So we're looking to create courses that are more tailored to different minority ethnic groups. Again, Jeanette highlighted that at the beginning. And yeah, so we are in communications with Banbury Mosque at the moment. We're also starting a group with the Oxford University Hospitals BAME network that will hopefully be running from January. And our one-to-one virtual weight management program. So that is, like it says on the tin again, that more one-to-one support. It's a really exciting offering where it'll be very much client-led. So we won't have prescribed topics that we'll talk about each week. It will be really based on their individual needs. I'm sure there'll be a lot of questions around those. I promise we'll get those details to you as soon as we have them. We'll make sure they're out to you in newsletters and emails and whatnot. So ready for time to be quick. Okay, eligibility. So this obviously is an important one for you all to know. And the kind of main ones here are that we need clients to be Oxfordshire residents, working in Oxfordshire, or they need to be registered to an Oxfordshire GP. They need to be over the age of 18. We don't work with children. All of this is available on our website under the professionals page. So you've got that, all of this information at a click of a button, and we will also send at the end of this webinar. Around BMI, so generally we need BMI to be over 30 to take a client onto our courses. However, if they do have a comorbidity such as hypertension, then that lowers down to 27.5. And as you can see there, it does also lower again if the client is from a minority ethnic group. So just to finish, our contact details. Again, we'll send this around afterwards, so don't worry about scribbling it all down, but we're really open to questions if you want to hear more from us, if you want us to come and present to you as a team, we're really happy to do that. But yeah, just to remind you that you can refer via EMIS or that clients can refer via our website directly. And that's it from me. So who have we got next? We've got Karen, don't we?
Thanks, Ellie. Yeah, thanks for that really informative presentation, Ellie. And like I say, everyone, please do have a look at the Achieve website. There's lots of really accessible information on there for you. So now it's my pleasure to hand over to Karen Davies, who's our lead dietitian from Thrive Tribe, Achieve Oxfordshire.
Thank you, Ellie, and thank you, Jeanette. Well, what I'm going to outline today is the talking about weight training that we're hoping to provide for groups of health professionals, because we can all be sensitive when it comes to talking about our weight. And as health professionals, we're well aware that we can't fix everything in one appointment, but that first chat, that initial conversation really matters. So for your patients with a raised BMI, how confident are you to have that conversation about promoting a healthy weight? Well, let's find out. So Ellie, if you could share the first poll question.
Yeah, let me know if everybody can see that properly. So you should see what are the barriers to having that initial conversation. Give you a little bit of time to vote.
Yes, so what we're asking you to do is have a look at the options after the questions. What are your barriers to having that initial conversation about weight? And obviously all the responses are anonymous, and it should give us a graph and give us an idea of what people's barriers are. Obviously there is an option there if you don't have any barriers. So yeah, so if you could just submit your answer on there, that would be great.
Seen a couple of people saying they can't see it, might be due to the browser you're on, or if you're on your phone, but we'll let you know what people say. Can you see the results there, Karen?
No.
Okay, we've got a fairly even spread actually across them. So people saying that they don't have any barriers, that they don't have enough time, it feels too awkward or embarrassing, or they don't feel they have the adequate skills or knowledge, or they just don't know where the signposting support is. So yeah, pretty even spread we've got there.
Lovely, thank you. And then if that leads into the second question about what do you feel would help you to feel more confident to initiate conversations about healthy weight with your panelists.
So that should be sharing about what will help you feel more confident.
That's lovely, thank you, Ellie.
And if anyone can't see the poll, you could always pop things into the chat that you think would help you feel more confident too.
And so, Ellie, what are the results for that one showing us?
Let me see actually if I can share. Can you see that now? So most people have said that having easily accessible information that they can give to patients, that's 63% of people. And then specific training, and that's good because that's what you're about to go into. Increased awareness of appropriate advice to give, and having more time. And then only a couple of people answered saying that they feel really confident already.
Lovely, thank you very much. So for those of you, thank you for filling in those, because it gives us an idea of the spread of what people feel they would need to help them have that conversation with patients. So I'm just trying to move on my next slide, but it doesn't want. Oh, there we go. So studies have highlighted that the top 4 reasons that are stated by doctors, by GPs, by trainee doctors were the following. The first one was that, as some of you have highlighted, they didn't have enough time to raise the issue of weight. Another reason was that very delicate doctor-patient or health professional-patient relationship, and establishing that rapport and not wanting to upset that rapport because it feels too personal. Also, this one sort of identifies the elephant in the room, really, in terms of that some health professionals aren't always confident about the decisions they make about their lifestyle, so that they don't feel they're in the place to advise others. And they're not exactly sure what's available locally that would help, managing weight for those patients. And some of you watching may remember taking part in the Oxfordshire primary care study about healthy weight. And that was a confidence scoping exercise aiming to identify potential gaps and to fill the gaps with training. And the primary care survey identified as the top 2 barriers that not enough time, and that people weren't very confident about where to signpost or to refer for support in achieving a healthy weight. And so in terms of what we're able to provide from Achieve Oxfordshire, there are two things that we're able to provide. The first thing is that we're able to introduce health professionals to the Achieve Knowledge platform. And this is a digital learning based platform. It's experience based and it provides learning on the go. You can do it on a laptop, on a mobile, on any device you happen to have in front of you. And what we've included is 2-minute bite-sized chunks of learning. There's practical videos, there's conversation starters, there's downloadable tips and tools, and we've also included some animations to make the learning fun. And one of the other things we've done is we've actually talked to patients and asked them how they would like health professionals to talk to them about their weight. And it's really about empowering patients to make those small changes in behaviour, and it's helping health professionals with the skills and the tools to do that. We've divided them into 4 sections, so raising the issue, moving more, eating well and staying on track, and there's access to a whole range of bite-sized chunks of learning and some animations and some case studies. And you can access the Achieve Knowledge through the website. If you click on the Professionals tab, and then that will take you to the training page. And then if you click on that, that will take you through to getting the knowledge. And then you'll be able to get instant access, and you'll be able to to create an account and work your way through all that information there. And again, just click on the website to get the knowledge. And the other thing we're able to offer at Achieve is that we can offer bespoke training in that talking about weight. So if you as a group of practitioners or a group of health professionals in a GP practice, in a pharmacy, within the hospital, wanted to improve your confidence in raising the issue, do some experiential learning and have an opportunity to practice skills around starting a conversation, then we're able to come along and help organise that for you. And the way we can do that is if you contact marketing at Achieve Oxfordshire, you'll be able to find out more. And patients know what they need to do, they just need a little bit of help from you to make it happen. So let's get talking. So thank you very much.
Thank you, Karen. Thanks, that's really interesting. And just to let everyone know, this is a new training kind of opportunity that Achieve have launched in Oxfordshire this year. So we do encourage you to have a look at that information and make the most of it, and let Achieve know what you need, what makes most sense to you and how it can work best within your time. So what we'd like to do now, please, is hand over to Annie Holden, who's a Strategic Health Relationship Manager from Achieve Oxfordshire.
Thanks, Jeanette. Just about to try and share my screen. Okay, so thank you for inviting me to be part of this webinar today. I think just to set the scene in terms of some background to who Achieve Oxfordshire is, some of you may be familiar with us, but we are one of 43 active partnerships across the country, and we work with our local communities and strategic organisations. We're an enabler, and our vision is to support everyone to be physically active across the county, but we focus specifically on those people most in need, to work with them, to support them and to become physically active, specifically to improve their health, both physically and mental health and well-being. So let's kick straight into, if we can, please, another poll question for you, a bit of interaction here. So the question for you now in relation to physical activity is, how many times do you think a healthcare professional needs to advise physical activity before a patient becomes active? Now, whilst you're completing the poll, if that's okay for that to be launched, you can see the options on the screen here. A bit of background. We know that physical activity is a very complex behaviour. There's no single bullet, there's no magic wand that suddenly enables people to be active. So if you can see the poll, perhaps you'd start to vote to see which one of those you think may be more relevant to this population. And I can just give you some background information in terms of the evidence tells us that to support someone to stop smoking, it can take anything between 50 to 120 attempts to support them. And I can see you're completing the poll at the moment, and actually a lot of you are quite right. It can take up to 12 times, so not as much as stopping smoking, but nevertheless, it still can take a variety of efforts to support individuals. And it might not be the right time for some, but if we can have that kind of consistent messaging and support for individuals, then we're more likely to achieve that change in behaviour. But let's set the context for this before we look at the specific signposting options out there. And in terms of the current situation and the unprecedented crisis that we're in at the moment, as Jeanette alluded to earlier, prior to COVID, both nationally and locally, physical activity levels were increasing. But obviously since COVID, there has been a significant decline in activity levels. Although 7 in 10 of us have felt that it's important to be physically active during the pandemic, and specifically using it not only to manage physical health but mental health as well. But if we look at the slides on the left-hand side in relation to the local context for Oxfordshire pre-COVID, we can still see that even then there were 99,000 adults in our community who were inactive. And clearly, therefore, as a result of COVID and the pandemic, that number is going to be significantly increased. And within that, we know that there are greater inequalities amongst physical activity levels among specific groups. So particularly those in our more deprived groups, our older adults, those with a long-term health condition or disability, and there are more women than men who are inactive. So we know that COVID is going to exacerbate these numbers, and it's going to have a significant decline in relation to activity levels. But if we look at it from a positive perspective, we know that there's a substantial scientific evidence base in relation to the benefits of physical activity and the positive impact it has across a range of chronic conditions and diseases, across more than 20 of them, including mental health, as well as the obvious physical health as well. And in addition to that, we've always known that physical activity can support our immune function. And this evidence base has been increasing since COVID has been upon us, and the beneficial impact of how physical activity can support that. And in addition to that, we also know that 2 key risk factors for COVID are obesity and diabetes, of which, again, physical activity can play a key role in trying to prevent as well as minimise some of the severity of some of the conditions of the symptoms of those who do contract coronavirus. And more recently, as part of the rehabilitation services that are being rolled out across the country, that is inclusive of physical activity in recognition of the beneficial impact of it and the vital role that it can play in supporting the NHS and our primary care practitioner partners to minimise the severity or manage the symptoms post-COVID. And some of you may also be aware that our Chief Medical Officer, Professor Chris Whitty, in the early stages of lockdown in a national briefing, simply said exercise is always a good thing. And this was reiterated by him last week as well, again, in terms of a national briefing at a specific event. And just encourage us all to think about physical activity as being a key part in the toolkit for prevention, because it has that beneficial impact on preventing and managing those range of diseases, that it can help to play a key role in lowering the prevalence of specific conditions, particularly in relation to those risk factors for COVID-19, and then has that ongoing role in supporting those from the immune perspective, but also in addition to that in relation to the severity of symptoms of COVID-19. So that's the backdrop of the current situation. So we know that this has impacted on the ability of a lot of our local communities to be physically active. But let's look at now to see how we can support you and our healthcare frontline workers to signpost patients and clients into activity options. Just to state first of all that there's no centralised referral service. We don't provide that. There's no centralised referral service of physical activity across Oxfordshire, but there are various referral sources and services that are out there, and obviously Achieve is one of those. But just to point out that one of our primary points at which you can signpost your patients to is our Go Active website, which is actually undergoing redevelopment at the moment and will be, so you'll see significant improvements over the next few weeks as well. And there are three key elements here in relation to the options that are there. There's the Go Active Get Healthy Diabetes programme, which I'll talk about in a minute. There are some directories available on there. There's information around self-care resources as well. So it's a good opportunity to signpost your patients into these, into our website, and lots of links are available through the website. There's also lots of information on children and families activities, but time won't allow me to go into the detail of that today. And some of you may be aware that there was or is a county-wide exercise referral service, and I hesitate between was and is because obviously that's severely limited at the moment because of the impact upon our leisure providers and the activity opportunities in the community. But if I can just focus specifically on Go Active Get Healthy Diabetes at the minute, because obviously this is aligned to managing obesity as well and associated comorbidities. And Go Active Get Healthy Diabetes is a programme that's been in place for well over 3 years now, commissioned by the CCG. This one is directly commissioned by the CCG. And it's available to patients with a diagnosis of type 2 diabetes. We coordinate it, but it's our local district coordinators who are the people who are skilled in providing that critical motivational support from, underpinned by behaviour change to encourage and motivate individuals to become physically active, and signposting them and guiding them into the activity options of their choice, but in relation to what's available within their localities. and they provide that ongoing support up to 6 months. And as a referrer, you can access a referral form which is available on the EMIS system, which goes through a centralised secure route, or there is a self-referral option for your patients via the Go Active website. Now, I think what's not so much better, but to hear the story directly from a patient themselves. Now, let's see if technology is on our side today. I'm going to try and play you a clip from this video via YouTube, but if it doesn't work, then you will get this clip a little bit later. But I think it's much more beneficial to listen to Dick Tracy's story, who was referred to the programme last year. He was diagnosed with diabetes by a GP who referred him into the programme, as Dick Tracy was very anxious and very concerned about his condition. So let's see if technology works, and I'll play this now, I hope.
People said to me, Dick, what are the benefits of doing all this? I would say, well, obviously not having to take all that medication, certainly not having to inject 4 times a day, the inconvenience of that. I just feel mentally better. I know that I'm in control of my diabetes, and I just feel more awake. Originally, I started to do it to put my diabetes in remission, but actually there's other benefits of it that I hadn't anticipated, and I only realised after I got rid of the diabetes bit, if you like. But it's more than that. It's more than the physical stuff, the psychological well-being as well. I actually cured my diabetes. Cured is the wrong word, but I put it into remission. I've done that, me alone, with the help of Go Active, because it wouldn't have happened without those guys. But I've done that. And that's quite powerful to know that I done it. Coming from less than a year ago, this 15 stone, 9 pound chap, type 2 diabetes, I've moved through this exercise program to where I'm still carrying a little bit more weight than I'd like to. So that's still ongoing, if you like. But I've got rid of the diabetes, that's in remission. I'm now under 13 stone, 7 pounds more to lose to get my BMI down to 25. That will be achieved. There's no doubt about that. I'm regularly exercising every day and enjoying it. The future, what does that mean to me? Well, what it means to me is Snowdon, that's always been something I wanted to do, haven't been brave enough to do, will be done, and probably this year, if not definitely next year. And I'm going to spend my retirement playing with the kids, the grandkids.
Okay, hopefully you were able to hear some of that, but we will send the link out for you to be able to access the full recording of that powerful story coming from a patient himself, that's for sure. And I do know that his intentions to climb Snowdon may have been deferred, but he still intends to do that. But let's move on then and look at what else is available out there for you in terms of signposting your patients to, or getting information from. You're probably very familiar with the Live World directory, which is available on the OCC website. And also there is further information on each of the district councils' websites in relation to their local activity opportunities available. Oxford City, for example, launched their Go Active Outdoors programme earlier in the summer, so there's specific information in relation to that. So you can go directly to their websites, or you can go quite conveniently to the Go Active website, and we have all those links available there for you as well. In addition, we know that there was a big drive in the early stages of the pandemic to move a lot of classes to online, and certainly Age UK did that as well with their classes. But in addition to the online option, they also have DVDs and hard copy resources available as well. There are health walks that still will be available to go across the county once lockdown obviously is lifted, and that is compliant with the guidelines through the Walking for Health National Initiative as well. And then there's the self-care options, and this is just a quick overview of what resources are available to enable individuals to self-manage, to self-care. We always advise and recommend people to go to trusted sources, so clearly NHS is one of those, and they have a range, a wealth of exercise and fitness options on their website, and they accommodate people of all abilities, all conditions, comorbidities, functional capacity levels, so it's a very comprehensive suite of exercise opportunities there. Obviously, apps, there's many of them available, and some of these may support some individuals. Again, Public Health England is a trusted source. You may be very familiar with the Active 10, which is an app which to support someone build up their walking levels. And similarly, Couch to 5K, moving from sedentary to ultimately a 5K run, should that be applicable for those individuals. So it supports them, it gives them goals, it agrees the goals, it's easy to use. And in addition to that, there's the XE app, which is another free NHS endorsed evidence-based app, which provides a personalised exercise plan, but also importantly accommodates individuals' different conditions or comorbidities and adapts the exercise prescription accordingly. And that's what we're using currently within the Active Get Healthy Diabetes programme as one option or activity option for our patients on the programme. And then not forgetting those individuals who don't have access to digital online options or don't want to connect that way. There are the hard copy resources that are printable off of, again, trusted sources websites, such as the Public Health England one, Active at Home Here, as developed with Sport England, but also our district coordinators, they also have activity packs that are available as well through those specific services. And just to reinforce here, the important message here is that we're trying to enable individuals to move more. And the World Health Organization published their revised guidelines last week, of which their underlying message was every move counts. We just simply need to get our communities moving from that sedentary, risky behaviour into an active activity behaviour in terms of some is good, more is better. And then finally, just to look at what's training is available for you as healthcare professionals. There is the PHE Physical Activity Clinical Care Training that is available across Oxfordshire. It's online now, much more easily accessible. There are the online moving medicine resources, which are available across a range of specific conditions. And there is also the CCG training, behaviour change and motivational interviewing that is provided, which I'm sure some of you have probably accessed already. More of that information will come out post this webinar as well. But final poll question, and this is really important to us because we're here to support you in terms of how to promote physical activity. So if you don't mind launching the last poll question, please. And whilst you're doing that, I'll just say that if the options that are provided in the poll don't cover what you think is needed, please put in the chat, because we will look to see what you recommend should be provided for you. And whilst that is being completed, I'm just going to complete with the final slide. I'm just conscious of time, if that's okay. Just to note that please access our website. We have a newsletter that you can sign up to, and other social media links are on the slide here. But otherwise, thank you for listening today. Thank you.
Thanks, Annie. I'll just share the results for that. So most people there saying signposting materials would be really helpful. So I think we're moving on to Emma now.
Yeah, I just want to say thanks very much, Annie, for that really comprehensive overview. And again, there's lots and lots of information that everyone can find on the website. And it was just really nice to hear Dick Tracy's story. It's really nice to hear from a patient. So now we'd introduce Emma, is Health Improvement Practitioner for Here for Health.
Hi, thank you, Jeanette. So yes, I'm Emma Higgs, and I lead the Here for Health service, which is based at the Oxford University Hospitals. It's a real pleasure to be part of the webinar today, so thank you very much for inviting me along. So Here for Health provide a free service for staff, patients, their families and visitors that access OUH. As a team, we can provide guidance and support to help people create their own health and wellbeing plan with a focus on what matters most to them. We can provide a safe space and the time to explore what would benefit them the most, as well as the opportunity to create a step-by-step action plan that's self-paced, realistic and achievable. Throughout, the individual remains at the centre of the discussion and completely in control of what they can and want to do. Our friends and family feedback shows that people feel free from judgment, that they're listened to, understood, and leave with a sense of purpose, that they feel more confident and motivated that they can improve their health and feel more energised and know where to turn to for support. When open on site, we are able to provide a drop-in service alongside remote support via video and telephone consultations. So our flexible service model means our team can work off-site as currently needed to maintain the valued one-to-one support. So this is a summary of our service model. We can be accessed by two methods. So an individual can self-refer by contacting the Here for Health team directly via email or telephone, or when we're open on site by dropping into one of our centres. An individual can also be referred by a healthcare professional via, if they're working within OUH, EPR, or external email or telephone. So all individuals are offered a lifestyle consultation and access to information and support on a range of lifestyle topics. And these include becoming more active, healthy eating, self-care for general well-being, weight management, reducing alcohol, and stopping smoking. So all of our consultations can range from a brief chat to longer conversations, depending on what is most suitable for the person. So within the consultation, we use a variety of evidence-based strategies that draw on behaviour change theories and motivational interviewing, and all our team are also mental health first aid trained as well. Our approach is very much centred on the individual, so what matters most to them, what they would like to do, how they'd like to go about it, and what support they might need. So we've developed links with many different community services to support people closer to home with their lifestyle. For example, physical activity, weight management, or stop smoking support. And we're able to guide and support people from any county across the country and have established links with community services in many of the UK counties, not just within Oxfordshire. So I'd just like to share with you a few feedback comments that we've received. So we do support a diverse range of people and in many different ways. So first one on the screen is the person came away with a plan as to how they could improve their overall health and fitness, and they left feeling supported and encouraged to take control, and overall rated our service as excellent. I also got feedback from a consultant who refers into our service that we've been a really valuable resource, that we're experienced staff that provide people with the time and knowledge to enact lifestyle change and really have a positive impact on the person's well-being, and that's both mental and physical. And finally, this was from someone who was recently diagnosed with cancer, and they felt like a lot of it was out of their control, and the Here for Health team were able to make them feel like they could actually make small changes to move in a positive direction without feeling overwhelmed, and that they were given time to talk through their concerns and felt supported. So as well as one-to-one support, there's also broader elements to our service. So these include running health promotion events and sessions, often in partnerships with other teams and organisations. So in the past, we've been with Achieve, Go Active, and Generation Games. And in response to the impact of COVID-19 pandemic, we're not allowed to do these physical in-person promotion stands. We're currently exploring virtual patient and public engagement promotion opportunities. We also support staff teams in having health promoting conversations with their patient groups. We can also do stop smoking advisor training champions for within OUH, which is linked to the National Centre for Smoking Cessation Training, or also signpost to Smoke Free Life Oxfordshire for the training. And we can provide information and resources across a wide range of health topics and community support services. So we're very much sort of an information hub as well. So if you would like any further information on any of these broader elements, feel free to contact our team. The details will come up at the end of the presentation. So as previously mentioned, people can self-refer to our service, and also professionals can refer patients in both within and outside the trust. So the telephone number and email addresses are up there. So we do request, if you're emailing us externally with any patient details, that it's done on the nhs.net account. But for general inquiries, you can use our Here for Health account, or if you're an internal OUH staff, then that's okay to use that address too. And then for OUH staff, there's the electronic patient record referrals option where you can refer to health and wellbeing, which comes through to our team. For the most up-to-date information about where we're based across the hospital sites and for our opening times, as well as a bit of a wider information on the team, it's best to visit our webpage, which is www.ouh.nhs.uk/Here for Health. So thank you very much for listening.
Lovely. Thank you very much, Emma, for that really interesting presentation. And it's really good to hear about the preventative approach both taking place at a primary care and a secondary care level, and just sort of letting everyone know how we're working together across that healthy weight pathway. So that sort of draws to the end of our presentations for the day. And Ellie, could you just, I think I've done that one, could we just have the final slide, please?
Yeah, 1 second. I'll move on. Oh, sorry, wrong one. 1 second. This is the one we want.
While Ellie's popping that up, just like to say thank you very much to all of our presenters today for the informative presentations and all the information, and we will be sharing all of this information with you. I'd like to also thank all of our participants, and do please let us know if you've got any further questions that we can answer for you. We will be sharing some additional resources with you all after today. Some sort of additional information and links that will be really useful from all of our providers. And just a few things, take-home messages, and what we'd all encourage everybody to do now is maybe passing some of this information to colleagues, maybe not quite as easy as it used to be, sort of having a chat, making a cup of tea or coffee, but maybe email or in a team meeting or various chat functions, looking at maybe some of the different pathways that are available for patients, and looking at the various websites from Achieve and Active Oxfordshire and Here for Health. Adding resources to your patient websites and notice boards, because very much we are tailoring all of our information for a general population, and direct patient communication, text messages and emails. So thank you very much, and we look forward to kind of either hearing from you or meeting you all soon.
Fab, thank you, Jeanette. Just to let everyone know, we will be answering every question in the chat box that we haven't been able to answer. We will be providing that in the follow-up email. So thank you very much for all your questions. But that's it for today. So I'll draw a close to this. We'll share around the recording for you to share with any of your colleagues, and all of the resources and information on this. Thank you everybody for joining, and Jeanette for hosting. And yeah, have a great afternoon.